Good morning and a warm welcome, and thank you for joining us yet again on Sunrise at Sea, just in time for your favorite segment, and this is Lifestyle, Beauty and Wellness. However, this beautiful morning on Wellness, we're going to be discussing an issue that has cropped up now and again, and that is the blood clot. Now, this particular issue has actually led to the demise of prominent people in Uganda, including we have had people like Major General Paul Lokech, who died from a blood clot. We have had Archbishop Cyprian Lwanga. We have had Major General Kaside Gwanga. Of course, after a post-mortem was conducted, it was seen that they died because of blood clots. Now, this morning, joining me to discuss this particular issue is Dr. Dungu from the Cancer Institute. And I am so excited because this is a conversation that I have always wanted to have, and I hope that you are able to pick a thing or two. Do not forget that you can actually be a part of this conversation by going to all our social media platforms, that is at CTV Uganda. Good morning, Doctor, and thank you for allowing to be part of this conversation.
Good morning, and thank you for having me.
Yes. Now, let's dive right into the subject matter. Of course, understanding for the viewer this morning, they might even want to understand what is a blood clot, because to many, they might break it down as just blood getting accumulated in one position. In your capacity, what is a blood clot?
A blood clot is when blood solidifies. Under natural circumstances, blood should flow. You know, from the time of formation in the womb, the circulation forms, and blood is meant to remain in a position of liquidity. It should be, there's no time blood should stop flowing. So for some reason, if blood stops flowing, it will clot. For instance, if say blood runs out of the vessel, you get a damage and your blood vessel is, say, cut or injured, blood will leak out, and it will stop bleeding by forming a clot. Or if you did put blood in space outside the body, it will clot. So that is clotting, and it's a natural phenomenon. When you look at how our bodies are made, to keep us healthy, we have a system for keeping blood in a liquid form, but also a system for causing blood to clot as a defense mechanism. As I said, if you injured yourself and you start bleeding, if we don't have a clotting mechanism, you're going to bleed to death. But if you have a clotting mechanism, it is going to, you bleed and then stop after some time, unless if the injury is so much. So when you talk about clots, and I suppose from what you've said, people who have died of clots, now we're going to talk about clots that are in the vessels, what we call blood clots in the vessels. We call it either deep vein thrombosis.
Yes, or embolism. So does
or
that fall
arterial
under the
thrombosis.
types?
Yes.
Okay.
The general term is venous thromboembolism. But when you talk about thrombosis or blood clotting, it means we are talking about both arteries, and the arteries are the ones that carry blood with food to the rest of the body. So if you get a clotting in an artery, it means that particular artery where it takes food, that part of the body will be deprived of food. And that's why if it is an artery in the heart, then you get a coronary thrombosis and you get into a heart attack. And if it's major, then the heart will stop. A heart attack, major supply, the heart will stop. So it's one of the common causes of sudden death. When you get a clot that forms in one of your deep vessels, say of the leg, of the lower limb, it is going to form in the deep vessels, and then if it slowly moves up and continues going up, you know, it's a thick kind of sludge that is moving in your vessel, and it lodges into the main vessels of the lungs. Now, this one which formed into the legs is a clot. When it breaks loose, we call it an embolus. And that's why you hear words like venous thromboembolism. That initially it was in point A, it moved and now dropped into another point. So if it drops into the lungs, depending on the size, it will cause significant symptoms.
But now, then it would bring me to the next question, and also for someone watching, because if you're talking about thrombosis and embolism, and we're basically putting these two terms together, what causes it?
What causes thromboembolism? There are usually three factors. If you get anything that reduces the way blood should run in a blood vessel, for example, if you have damage to the inner lining of a blood vessel, if you have, things forming, the way people make roads and put humps, it is going to slow down blood. And when blood slows down, by default, it will think that there's a problem. It will clot. So one of the factors is injury to a blood vessel inside. Two is if you have an imbalance in the mechanisms to stop you from bleeding or to help you clot. If there's loss of that balance where you have excess clotting, then you're at risk of getting clotting. Or if you have in your body factors that increase the risk of bleeding, of clotting. For example, you have abnormal proteins, you have abnormal blood cells, all this can come together. But the commonest cause of all this is when you have stasis. Whenever there is a stampede that stops blood from moving, it will clot. For instance, if you are in hospital for one reason or another, and you are not able to move your limbs properly, it means that this blood is no longer flowing. It can clot. If we put a cast on you, what you guys call plaster, because you've broken your leg,
Yes.
depending on the tightness of that cast, it can reduce or slow down the flow of blood. If you have undergone surgery in theater, and you are in theater for maybe 4 hours, they're operating on you. During that time, when you are paralyzed, your blood is not moving. So the risk of clotting increases.
It's quite interesting because many times, it's not that I was a very problematic child, but the few times that I did injure my leg and my doctors kept on putting a cast on me, I would always tell them, because my parents would tell them, tell the doctor not to make the cast so strong on you. And I used to wonder why.
If you make physical occlusion, it means blood is not going to flow. And if blood does not flow, it clots. So that's why there are many people who have been admitted in hospital, they've undergone procedures, they're discharged, they reach home, they become very sick, they die.
But how are you able to tell that you have a blood clot? Because even for some people, you may not realize it until it has already become deadly.
So depending on where it is, and the commonest site is the limb, the lower limb or the legs, a blood clot usually presents with swelling
on the body itself.
Of the body, or of that part of the body. So if it's in the leg, you get a swollen leg. And then that swelling is associated with pain. Many times when the swelling comes, it won't even go away when you wake up. There are people who get swollen legs and then by the time they wake up, the swelling has gone. This one persists. Even when you do massage, the pain remains. It's a feeling of like someone is pumping something in your leg and it feels really tight. That's how it presents. In some people, they might get a bit of color changes of the limb, especially if you're light-skinned. The limb might look a bit different. And that is when people start running and say, I think you've been bewitched.
But now for us, the dark-skinned people, we cannot know.
We may not know, but if you're careful, actually, you can tell there's a change in the way your skin looks like. So those are the commonest. Swelling of a leg without prior injury. Pain in the affected leg. They are the commonest symptoms of a clot when it is still in the leg. But when it moves to, say, the lungs, you're going to present with sudden onset of difficulty in breathing. You are not able to breathe in properly. Sometimes when you take a breath, it is extremely painful. Someone might present with coughing, and when they cough, they have blood in the sputum. Or sometimes someone just collapses, and we only confirm it was a blood clot after postmortem.
But doctor, then my worry or my concern would be, okay, now that we have understood the symptoms and also what causes it, is there a point to which when it has become very deadly? Like when would you know that now it's now high time we need to operate on this blood clot or we need to have it out? Is there like a time limit?
That time limit is not there, but usually the earlier the better. If you're looking at treatment of an acute clot, time matters, because the longer you delay, the chances of getting complications, including death. If you have a clot in the leg and the leg is swollen, you need to see a doctor. And here I'm not saying you need to see an expert like me. I'm saying you need to see a doctor, because any doctor can give you first aid to stop you from progression as they refer you to other people. When a clot is in the lungs, of course there's no time to wait. The challenge that many people will not know, it is you presenting to the doctor that I'm not feeling well, and the doctor uses their index of suspicion. You know, there are things we call probability scores. If you came in with a swollen leg, I'm going to use a probability assessment to see whether you need further evaluation or not. If you meet certain criteria, then you say, chances are so high that you have a clot. Let's do this test. And now we are lucky. There are some things we can do rapidly to tell us, to give us an idea of whether there's a problem or not. Then we start you on treatment as soon as possible.
Okay, so finally, as we wind up this conversation, looking at the different issues that we have discussed and put across the table this morning, the saying goes that prevention is better than cure.
Yeah.
Is there a way someone can just do away and do not have to battle when it comes to blood clots? Is there just a way?
To prevent it?
Yes.
I think to prevent a blood clot, you need to understand your risk. Because not everyone will get a blood clot. So we need you to know whether you're at risk. For example, if you have been hospitalized, you have, for one reason or another, you've been hospitalized and you're not moving. Someone who has had a stroke, someone who has had a broken bone, someone who is admitted, for one reason or another, they are at risk. If you have conditions such as cancer and you're in hospital, we know that cancer increases your risk of having a blood clot. If you're a smoker, if you're a person who lives a sedentary lifestyle, and then because you're not moving a lot, your body starts moving for you. You know what I mean?
Yes, I understand.
It starts moving for you. For you stay in one place, the body moves. You're at risk of getting...
So in short, more exercise.
If you don't do exercises, you're at risk of getting blood clots, among other diseases. So if you understand your risk, that me, I drink a lot of alcohol, I smoke a lot, you just know your risk is high. To prevent you from getting a blood clot is to try and reduce that. To try and eat healthy. These nice foods we love, they're good to eat, but sometimes they cause us trouble. So it's better to go to the not so good foods, the vegetables, we eat fruits, we eat, non-fatty meals.
Those are the meals we don't want to eat because we want to be eating chips, we want to eat a bit of sausages. When you talk about nakati and sukuma wiki, our faces change.
Yet eating bo and marakwang, those are good foods. But for us, we think those are for the villagers.
Oh, exactly.
Village life is the best. So you can prevent that. But also, if you understand your risk, it means when you are in situations that increase your chance of getting a clot, you can even notify. If you're in hospital, don't be shy. Tell a doctor, doctor, am I at risk of getting a blood clot? Because it reminds the doctor that, let me assess. And when they assess, they can put you on preventive treatment. Because you reminded them, don't be shy and say, how can you advise them? So
and they will say you have kajanja.
let them say that. But You remind them, open their eyes and say, am I at risk of getting a blood clot? You have a broken leg. Find out. So they put you on treatment to prevent that.
Well, thank you so much, Doctor, for being a part of this conversation.
You're welcome.
Well, for me, for one, the take home or the key points that I have picked out is that it's very important that you're cautious of every single thing that happens to you when you're in hospital. Do your exercise, eat good food. People, learn to eat nakati, eat skuma wikis. Don't stop saying that food is for villagers, but also it is very important that every time you go to a hospital, for whatever reason it is, ask your doctor, am I at risk of getting a blood clot? And that winds up the conversation that we had for you today on Sunrise at Sea. Good morning and don't blink.